Well, we as parents try to do the best we can when it comes to taking care of our kids, but sometimes there are so many questions as to exactly what really is the best for them.
For instance, your child's dental health. Do you really know when you should stop brushing their teeth and allow them to take over?
And what about what they put into their mouths, pacifiers? Their thumbs, are they okay, or are they going to lead to problems down the road in the future? Well, here to clear up a few of these questions for us today are Dr. Mariella DeStefano, pediatric dentist at Three Lower Counties Community Services, and Director of Dental Administration, Linda Riggleman. Thank you so much for joining us, ladies.
Thank you.
Dr. DeStefano, let me ask you this. My baby's going to lose those baby teeth anyway, so really are they that important?
Yes, absolutely. Baby teeth are the best guidance for permanent teeth eruption, meaning growth of permanent teeth coming in. That's right. Also, extremely important for chewing, absorbing of nutrients of food, as well as phonetic speech, and also breathing patterns. So I would say yes, absolutely.
Absolutely important. Okay, so our babies have pacifiers. Some of them suck their thumbs. All of my kids did either one of those. Does it harm their teeth at that age?
I would say actually, when parents come to the office and ask the same question, I would say no. It's actually a good comfort for the child in quiet times. After the age of 3, it could be extremely detrimental to the growth of the bone and also to the development of permanent dentition. So by that time, it'll be the time that you should consult with a specialist to see if there is time of intervention that could be done.
Okay. Now, obviously we want them to brush their teeth. When should we start that?
By the time that your child is 1 year old.
Oh, really?
Yes, they should be brushing their teeth.
Okay.
Even if there's just one tooth?
Yes, even if there's one tooth.
Okay.
How about that?
And then, and what about going to the dentist? When should we let them go to the dentist?
AAPD, American Association of Pediatric Dentistry, recommends that they go to the dentist by the age of 1 or at the time that the first tooth erupts. Okay? So said that, granted that, as complementing Mrs. Rugerman's answer, we should start brushing at age that the first tooth comes in with a soft toothbrush that is suitable for the patient's age.
Okay.
All right.
Let me jump forward here real quick, Dr. DeStefano. We hear a lot about sealants. Do they really work? Are they worth the trouble?
Great thing.
Yeah. Why?
Highly recommended. It's a coating that goes on top of the, especially the permanent teeth, the posterior permanent teeth, and that protects from bacterial growth and plaque formation, further preventing dental caries. So it is highly recommended, the place of sealants, especially when the first permanent teeth come in to the child's mouth.
I'm sorry, you said dental caries?
Caries, cavity.
Cavities, okay.
More popular word, yeah.
Okay. What about fluoride? How do we know if they're getting enough fluoride?
Okay, so fluoride can be absorbed through several ways, primarily through tap water, cedar water, okay? Fruit juices that comes in cans, toothpaste, mouthwash that contains fluoride. So I say it's extremely important that you consult with a specialist to see how much of fluoride the child is absorbing.
Okay. Now, let me ask you this real quick, just because I want to make sure. If you can't afford a dentist, are there ways to get help?
Yes, there are ways to get help. At TLC, we work closely with every patient to make sure that we're going to provide the services that you need at an affordable cost. We have a couple options that you can do. We have a sliding fee scale, which is different fees. We also do payment plans. So we encourage everyone to come in and let us work with you just to keep your oral health.
And you guys handle kids everywhere from 1 to 21, special needs and the whole 9 yards.
We do, and we have a staff of pediatric dentists.
All right,
Linda,
thank you so
Dr.
much,
DeStefano,
ladies.
thank you. Wonderful having you.
Thank you very much for having us.
And for more information from 3 Lower Counties on proper care for our children's teeth, go to delmarvalife.com and click on the show tab. Well, coming up on Delmarva Life, you know you've done it. The armpit sniff test.
Yeah.
You can get body odor even if you use deodorant. Why, that burger you had last night may be to blame.
And a little bit later on, if you like rock, pop, blues, funk, you don't want to miss the music this afternoon. The Monkey Paws take the Delmarva Life stage. But first, we just learned about taking care of our children's teeth. Dr. Oz says it's important because clean teeth can help with a healthy heart.
Your toothbrush and dental floss are some of the best weapons against heart disease and stroke. Gum disease, known as gingivitis, has been linked to hardening of the arteries, which can lead to all sorts of problems, from erectile dysfunction to a heart attack. Begin every day by brushing your teeth gently and massaging the gum lines with soft bristles for 2 minutes. A whopping 80% of folks still don't floss, and it's critical to prevent gum disease. Do it every day the right way. The floss will barely pass between each tooth and just gently touch the gums. You can't remove all that dangerous plaque on your own, so see a dental professional every 6 months. Brush up on your dental care. You'll have a whiter smile, sweeter breath, and a longer life.